Hi there, everyone. Good morning or good evening, depending on when you're watching this video. My name is William Derrick. I work alongside the Psychological Assessment and Treatment Seeking Lab, or PATS Lab for short, at the Texas Tech University Psychology Department. And I work alongside my PI, Dr. Paul B. Ingram. And the study I'm going to be presenting today is titled Mental Health Help Seeking, Health Implications for Individuals Who Seek Aid. So just as a rough abstract, our background, this study evaluates how individuals perceive their physical health after having sought mental health help. Studies have consistently found that mental and physiological health are closely connected. However, the effects of mental health care provided by different providers on physical health perceptions is not as well documented. This study is trying to aid in documenting these observations. As for our research question, how does perceived physical health differ across individuals who seek help for their mental health from different types of providers? Our participants, we had 375 participants. They were all recruited from an undergraduate research pool, SONA, at Texas Tech University. Participants were then asked to provide responses to different criteria, including attitudes about treatment, physical health, and mental health. And as our findings, our results suggest that those who sought help from both their family physician and from a mental health care provider, and those who did not seek help, they differed substantially in their self-perceptions of their physical health. So that's some background information. What is considered help seeking? So according to some other literature, according to Ganther et al., care seekers are individuals who seek out healthcare providers to help manage their health problems, including both physiological and mental health. So according to Ganther et al., care seekers are essentially individuals that when they get sick, if they're not feeling well, mentally or physiologically, they're more likely to seek out professional help from a primary care provider or from a mental health care provider than someone who would be a self-treater, as they coin it. Self-treaters are more likely to, if they feel sick, they're just going to wait it out, maybe have a ginger ale or something at home. They'll try and self-treat themselves rather than get professional help. Ganther et al. Also said those who seek help tend to have less behavioral risk factors for chronic diseases. So essentially those that are more likely to seek help tend to be more health conscious, and as such, they're less likely to smoke, less likely to excessively drink, and less likely to overeat. So they generally have less risk factors for chronic diseases. So why is this study important? You know, the findings from this study and similar subsequent studies can influence how individuals may be directed to seek help for mental health issues. So if it was found in subsequent studies that mental health care help was really beneficial for physiological outcomes, then it would change how we try to educate patients in the greater population as to how they should seek help for their general well-being. If it was found that mental health care help was extremely beneficial for physiological outcomes, then you would be much more likely to direct patients to have a substantial relationship with their mental health care providers in their areas. Going along the same vein, further understandings of how mental health care approaches and their possible effects on physiological or physical health can help educate future efforts to make healthcare more efficient. So as with all things, you don't want to allocate resources to problems that don't need them, and you also don't want people that have issues to not get the resources they need. So just to create a more efficient system, these sorts of observations are very important to kind of decide where we pump resources and allocate funds. In another piece of literature by Levine, published very recently in 2021, those with positive psychological health are more likely to have positive health behaviors that lower risk of chronic diseases. So for the methodology of this study, we recruited participants from the SONA participant pool at Texas Tech University. Participants within this pool are given course credit through SONA for participating. So essentially, many of our participants are freshmen at Texas Tech University, and in many of the introductory courses at Texas Tech and in other courses, they are encouraged to use SONA and sign up for studies like this one in the psych department and in different departments around campus, and they will get credit for an assignment for participating in those studies. So from SONA, we got an original pool of 409 participants, and then we screened out 34 individuals who failed more than 2 of our attention checks. So for this study, we had a total of 7 attention checks. Essentially what these are is, it's a question that says, if you're paying attention, select strongly agree for this question. And so it's a question that if you're paying attention is very simple. If you're not, we can kind of screen out people that are just clicking through. And so we gave them up to 2 mistakes on attention checks. So we screened out 34 people that had actually failed more than 2. So our final participant pool came out to 375 participants. Of that final group of 375 participants, these are their demographics. The key takeaways here is that the majority of our participants were female, white, and between the ages of 18 and 19, with a mean age of about 19 years old and a standard deviation of about 2.5 years. Criterion measures. So this study collected a whole lot of data. We got data on attitudes about treatment. We got information about people's physical health. We got information about their mental health. So for their attitudes about treatment, we had questions that measured things like mental health stigma. So how they viewed mental health help in general, if they felt that seeking help for mental health was something to be ashamed of. We had their perceptions of physicians and their perceptions of their insurance policy, if they thought that it was satisfactory to them and their needs. For physical health, we got information such as their weight, some information about their diets, their height, and several risk factors, mainly smoking. For their mental health, we got some measures of depression, anxiety, worry, but we also got some positive feelings on there, just for further comparisons down the line, not necessarily for this study. So for this study, we separated participants into 4 different groups. So we compared where participants sought their help from. So if they sought help only from a family physician for mental health care, if they sought care only from a mental health care provider, if they sought care from both, or if they didn't seek help for mental health at all. And so from our participants, most of them had never sought help for mental health, followed by those that had sought help from family physicians and mental health care providers. So generally, this sort of thing would look like if you felt depressed and you went to your primary care provider and then they referred you to a mental health care provider. That's not always the case, of course, but that's sort of what we see as most common. And then we compared these groups in their responses to some of these measures that I previously covered. We compared them using univariate ANOVAs with post hoc testing. And so from that testing, what we observed was that there were significant difference between 2 groups. The 2 groups that had significant differences were between those who had sought help from a physician and a mental health care provider, so they had seen both, and then the group of those who had not sought help at all for mental health issues. And so from what we saw, what we observed in this study was that those who sought help from both a physician and a mental health care provider, they had more positive self-perceptions of their own physical health. They had more reports that they felt as healthy as those around them. So this is a perception of their own physical health. They had less reports that they got sick easier than others. So in general, they felt that they got sick less than others. And we had lower reported incidence of illness. So they were those that had sought mental health help from physicians and mental health care providers actually reported that they got sick less than participants who had not sought mental help from either group. So why are these findings important? As I kind of said earlier, efforts could be made to include both family physicians and mental health care providers in patient care. So from these observations in a vacuum, you could say that it might be beneficial for family physicians and mental health care providers to both collaborate on mental health care help with patients. Further understandings of the interplay of mental health treatment and physical health outcomes could lend credence to increased coordination between primary care providers and mental health professionals. This sort of thing would be like interdisciplinary care. If you could have maybe a mental health care provider in the building somewhere for a family care facility, and maybe they're able to pop in during annual physicals just to see about mental health help. Why some of these findings might be limited, especially in the scope of this study, is we have a population with a very limited age range. The vast majority of our participants came from 18 to 19 years old, even more so between 18 and 22, and very few beyond that. We also have to deal with the fact that our population is, for the most part, limited to within a single geographical location. We are in Lubbock, Texas, and we are recruiting from Texas Tech University. Although there are some possible protections from confounding variables with this population. So since all of our participants were students from Texas Tech University, they are provided with access to mental health care and physical health care help from the Texas Tech Student Health Services. And why this is really important is it helps us to limit the confounding variable of socioeconomic status. Maybe if a participant didn't see anybody for mental health help because they couldn't afford it. That's not a concern we have with this population, because as students of Texas Tech University, they have access to both of these types of providers. And that is the end of my presentation. Thank you so much for sticking around. Have a great day.